So my name's Cheryl Hale, and I'm a family nurse working with the Family Nurse Partnership, which involves supporting young parents on the community for up until their children are 2 years old. So we visit mums on a weekly basis for the first 4 weeks of the programme, and then it goes on to fortnightly visits. And on the 6th pregnancy visit, we would bring in some materials to help facilitate conversations around what they know about breastfeeding and bottle feeding their babies. So we will look at what benefits and drawbacks of both, so that way we can elicit from mums what they already know, and then we can provide information that they don't know, so that they are they're fully informed about which decision they make. We would also encourage skin-to-skin contact with the baby. We would talk about common problems that they might have in the early days and how to overcome those. Maybe signpost them to breastfeeding cafes, to the breastfeeding workshop, so that they have lots and lots of information to help and support them with their choice. I would want to make sure that they were fully informed, so they were aware of all the benefits and breastfeeding, both to mum and baby, so in order that they could make an informed decision about their choice for feeding their baby, and equally if they wanted to bottle feed their babies, that they had that same information. So a lot of mums would want to know questions such as, is breastfeeding acceptable in public places? Obviously there are many places where they can breastfeed in public, but they hear all sorts of rumours about how they're going to be judged, especially these very young mums. So it's very much sort of helping them to understand that you can be very discreet when you breastfeed your baby in public. So it might just be that they use a muslin skirt or something under the bra strap, so baby can just pop underneath, and basically they can sort of feed baby anywhere without people even being realising that they are breastfeeding their babies. They might also ask questions like, how do I know that my baby's having enough milk? Because obviously with bottle feeding they can see that their baby's having so many mils of formula, whereas it's getting across to them that actually breastfed babies take what they need. You can't overfeed a breastfed baby. If it's painful, those kind of questions. So again, we would bring a doll into the visit sometimes, and we'd role model. We would help them to sort of handle the doll and sort of demonstrate positions for attachment and latching baby. Okay, so we try to encourage partners, or if a partner wasn't involved, a family member, to be present during the conversations around feeding baby. We would recommend maybe that mum goes to a breastfeeding workshop or to a breastfeeding cafe, and especially with a breastfeeding workshop, would suggest that dad goes along with her, so that he can find out a little bit more about it, how he can support mum, especially in the early days with breastfeeding. Sometimes we bring a doll into the visit, so we'll role model with the doll. So we might help mum with so they can both practice really with just sort of getting used to handling a baby, because the dolls we use feel very lifelike. So we would encourage a dad to sort of very much become part of that as well, and just to learn really, I very much encourage also skin-to-skin contact, so both with mum and dad, so that they can both bond with the baby, because sometimes dads feel that they can't get involved because they don't really have a role within breastfeeding. So would very much encourage dad to help maybe learn about changing the baby's nappy if it needs to be changed before feeding, handing baby to mum, sort of helping her if she needs any refreshments, and also very much babies often associate mum for feeding but dads for settling afterwards.